Hello all. Today we're talking about benzodiazepines. As usual, I'm gonna try and follow lecture objectives. Today here are a few lecture objectives. First, I'm going to compare barbiturates and benzodiazepines. Barbiturates are another class of anxiolytic drug that were commonly used, but have several downsides, so they're not really used anymore. Within this, I'm going to discuss the importance of pharmacokinetic in benzodiazepines and how that affects the way that they're used in medical treatment specifically. Then we'll talk in the next few videos. You'll hear about behavioral effects and pharmacodynamics. You'll hear about the addictive potential of benzodiazepines, and then just a couple of slides literally about tolerance and withdrawal from benzodiazepines, and I'll wrap up some of what I thought were the main points of this lecture. So, anxiety, in a very general sense, is linked to increased brain activity, especially increased activity within neurons that are involved in the HPA axis. So as you'll remember, that'll be the amygdala, the pituitary, and the hypothalamus. So it's going to involve high levels of cortisol being very common, and basically not the prefrontal cortex not having the top-down cognitive control over the amygdala that it normally should. So most treatments for anxiety are going to sort of reassert that inhibitory force of the prefrontal cortex onto the amygdala. There are multiple ways to do that, and barbiturates and benzodiazepines are the common ones. Barbiturates end in barbitol or pentothal. Phenobarbital is a really common one. Sodium pentanol, I think, is what's used in lethal injections. All of these are going to end in those two terms. They're older drugs. They're not as commonly used today. We'll talk about why. Benzodiazepines usually end in PAM or LAM. At least they're not their generic names, not their sorry, their trademark names like Valium and Xanax. Those are both trademark names, and Valium would be diazepam. Okay, so all drugs that are going to treat anxiolytics are going to be CNS depressants. This is also going to be true of alcohol, which a lot of people self-medicate use to self-medicate their anxiety. All of these are going to enhance the inhibitory forces within a neuron. So the most common route of administration for both barbiturates and benzos is oral, meaning if you like just through a pill usually. This is both for medical and recreational use. IV is possible, but it's typically medical use, either for anesthesia or because somebody's having a seizure. If somebody's having a seizure, they can't swallow a pill, so they'll most likely get an injection of a benzodiazepine. Only barbiturates can really be used for deep anesthesia that causes the loss of consciousness. Benzodiazepines cannot. One of the things that's going to really vary between different benzodiazepines and different barbiturates is the lipid solubility. That's also going to have a big impact on how that drug can be used, because it's going to have a big impact on the timeline. So if you want something that's sudden onset, that's really great for treating something like a seizure. Something longer lasting might be better for something like treating insomnia, right? Where you want somebody to stay asleep for a long time. So the metabolism is going to happen within the liver. It's going to vary based on specific drugs. We're going to talk about that more in a little bit. Benzodiazepines often have active metabolites that can cause a lot of problems. It's going to be excreted through the urine. This is sort of a timeline for the kind of effects that you would see in barbiturates. You don't need the information here, but if you're interested, it's there. We're going to talk more about the timelines for benzodiazepines in a minute. Okay. So some of the real differences between barbiturates and benzodiazepines are both their uses and their therapeutic index. So the length of a drug effect duration is going to vary from drug to drug. It can either be short, minutes, or days, right? Or long, and sort of in the span of days. Phenobarbital, which is shown here, it's sort of like the stereotypical barbiturate. That can have a paralyzing and anesthetic effect. It can also have a hypnogenic effect. Hypnogenic means that it induces sleep. Hypnagogic means it makes you feel sleepy. Calming and anxiolytic. So barbiturates and barbiturates can have all of these effects. Benzodiazepines can be anxiolytic and help you sleep. And those are two of the main medical uses, either treating anxiety disorders, generalized anxiety disorders, panic attacks, or treating insomnia. Why they're used for that, we can discuss, and whether or not they're fully accurate or fully effective, we can also discuss in the next video. So there is a big overlap here, but barbiturates can cause a deep anesthesia and loss of consciousness that benzodiazepines cannot. There is a pharmacodynamic reason behind this that we will discuss. But because barbiturates can cause this deep anesthesia, and because their pharmacodynamic effect is more pronounced, it is much easier to overdose on barbiturates. Barbiturates have a much smaller therapeutic index, while benzodiazepines have a fairly large therapeutic index. It is very difficult to, and again, not a challenge, not something I want you to prove, but in general, it's fairly difficult to overdose on benzodiazepines. However, most people who are abusing benzodiazepines recreationally are what we refer to as polydrug users, meaning they're using other drugs as well. So benzodiazepines can be really dangerous in combination with alcohol, and barbiturates in combination of alcohol is usually lethal. A lot of very famous people have died from barbiturate overdose, including Judy Garland and Elvis, and Jimi Hendrix. I think it had something to do with his death as well. So barbiturates are really dangerous, and they're not particularly used very commonly anymore. So when considering what benzodiazepine you would take, one of the things that's considered most is the metabolism, right? Especially the half-life. Okay? As you can see, in hours, these half-lives are all fairly long. There are short-acting BDZs as well. This would include things like Xanax. These are the generic names. I'm trying to give you brand names as well because I think sometimes they're more recognizable. Right? So different timelines lend themselves to different therapeutic uses. So these long-acting BDZs are more commonly prescribed in low doses for chronic panic anxiety disorders and insomnia, right? Because if you had something that's short-acting, it might help you fall asleep, but it wouldn't help you stay asleep. So a long-acting BDZ, something that lasts, for example, 8 hours, or has a half-life of 20, could help you fall asleep and stay asleep. The downside of this is that since there's such a long half-life, there can also be a real hangover effect from benzodiazepines. So that is one of the downsides of insomnia. There's also conflicting reports about how helpful they are for insomnia. Some people say that it really doesn't while it helps you fall asleep faster, it really degrades your quality of sleep. So they shouldn't be used in that context. Right? So the speed of onset and the metabolic breakdown are both what's considered in the short-acting and the long-acting BDZs. The long-acting BDZs all have active metabolites, meaning that they are broken down in various stages, and while they are in these forms, they can still have psychoactive effects. You can also get depot binding with any of these benzodiazepines, so that's also going to contribute to their long-lasting effects because it's going to get deposited in the fat and then slowly leave. Another reason why I mention metabolisms and active metabolites is that this is the reason behind why elderly people should not take benzodiazepines. In general, they are not prescribed to people who are elderly. As you get older, your metabolism slows down. So this long-acting effect and the active metabolites are really magnified in elderly people, and they see a lot of really bad side effects, especially ones that mimic dementia. And there has been some research that would suggest that the use of benzodiazepines when elderly increases your risk of dementia. So that is just a little bit of background about benzodiazepines and barbiturates and some of their medical uses. So next we are going to talk about the behavioral effects of benzodiazepines and the pharmacodynamics behind those behavioral effects.